Okay, well, I know some folks are still joining, but to be respectful of everyone's time, we're going to get going. Uh, First off, hello and welcome to today's webinar on haircare equity at the University of Vermont Medical Center. My name is Dan Olson. I'm the Executive Director of the Vermont Public Health Association, and we're really happy that you've all chosen to spend some of your time with us today. Before we get into the webinar, Vermont Public Health Association we're a state affiliate of the American Public Health Association. We are a standalone 501c3 nonprofit based here in the state of Vermont. And we really see our role as serving as a home for public health professionals, students, and community champions. For our audience today is really spread throughout New England and across the country, which is really exciting. I'm going to take one moment just to make a pitch. If you're not a member of your state APHA affiliate, please consider doing so. I think at moments like these, the role for independent organizations and independent voices is really critical to maintaining the integrity of our profession and making sure that we can have discussions on important topics like the one that we're about to discuss today. So without any further ado, I'd like to introduce our panelists today. Actually, I'm going to let them introduce themselves, but I'd like to hand the reins over to Kristen Fontaine from the University of Vermont Medical Center, and really happy to host today's webinar. Thank you, Kristen.
Yeah, thanks so much, Dan. We're really thankful for to the Vermont Public Health Association for hosting this webinar today. We're excited to be here. My name is Kristen Fontaine. I use she, her pronouns. I'm the supervisor for health equity and community access at the University of Vermont Medical Center. And I'm just part of this three-part panel. And I'm going to hand it over to Vanessa to introduce herself.
Hi, everyone. Thank you so much for having us. I am the executive assistant to the chief medical officer team and also the medical staff here at UVMMC. I was the former co-lead of the BIPOC Employee Resource Group, known as REACH, and I'm currently serving as the co-chair for the Black Experience Council that is newly forming. And I will pass it on to Kara.
Yes, hello, everyone. It's such an honor to be here with all of you. My name is Gira Demers. I use she, her pronouns. I'm the Diversity, Equity, and Inclusion Director for Employee Education and Experience here at the UVM Medical Center. Okay, so I will start off before we get into all the good stuff and just talk a little bit about who we are. The University of Vermont Medical Center is part of an integrative academic health system known as the University of Vermont Health Network. We are one of 7 organizations in a health network that serves more than 1 million residents across Vermont and northern New York. We are located in Burlington, Vermont. The UVM Medical Center is a regional academic healthcare center and teaching hospital in alliance with the University of Vermont. We are a level 1 trauma center with 620 acute care beds and over 8,800 employees. So we'd like to start with land and labor acknowledgements, and this is really in the spirit of honoring our Indigenous and Black communities. And we want to go beyond just Black History Month and Indigenous Heritage Month, which is in November, among other acknowledgements. So I will read this out loud, and you can read it with me, and then I will go into how we created and set up this land and labor acknowledgement. The UVM Health Network acknowledges that we live and work in Wabanakik, the historical and current homeland of the Abenaki peoples, and Ganonge, the historical and current homeland of the Mohawk peoples. We recognize the long history of genocide and land theft, used to create what we now know as the state of Vermont and the state of New York, as part of the United States of America. We commit to our shared role in land stewardship and seeking the voices and needs of Indigenous peoples. The UVM Health Network acknowledges the history of slavery and the rich contributions of African descendants for more than 400 years. We acknowledge the exploitation of labor for economic growth and our responsibility to address labor inequities that exist today. We carry our ancestors in us and are continually called to do better. This acknowledgement is one of many essential steps toward our commitment to create an inclusive environment of care for our staff and community. And this is especially important for us today because of this webinar that we're holding. This really speaks to the work and what we're doing here today. But land acknowledgements, if you're not familiar with them, they are a valued practice within Indigenous cultures. And that's that first paragraph here. And they serve an important role in raising awareness of Indigenous people and their enduring relationships as stewards of these traditional territories that we live and work on. Recognizing the land is an expression of gratitude and a way of honoring Indigenous peoples, both past, present, and future, who inhabit this land together with the University of Vermont Medical Center. The labor acknowledgement recognizes the economic injustices, and that's that second paragraph there. And it celebrates contributions of impacted groups and creates an awareness of labor inequities. Our land and labor acknowledgement was crafted with input from various community leaders, and that includes the Vermont Commission on Native American Affairs. So we did not create this in silo. And we recognize that this is an expression of gratitude and a way of honoring Indigenous and Black history. And thank you for doing that with me. Okay. So we'll talk a little bit about what our objectives are, and then I'll hand it off to Vanessa. Oh, I think we moved on. One.
No,
Oh, no, we didn't. Sorry.
the slide move?
There we go. Nope, we're good.
Okay.
All right, so we are going to connect our hair inequities and with historical and current sociocultural significance of hair care. We recognize there are many diverse hair types across the globe, and ethnicity does not necessarily define the hair types that someone has. So our project centers our Black and Brown community members who are among the first to experience repeated harms of institutional racism and intersectional oppression when they're expressing their culture and wellness to the world. And we'll go a layer deeper. We'll be talking about the individual impact of hair inequity on our patients, their families, and the healthcare workers. And we'll be using this time to connect individual experiences to the collective. And then we will be sharing our current hair inequity initiatives at the medical center, the UVM Medical Center. And we'll also talk a little bit about some of our next steps and how we'll carry this work forward through our network. And we will also go into the importance of quality improvement and how we can sustain some of this incredible work that we're doing. And I'll hand it off to Vanessa.
Great, thank you. So before we get into the details of our project, we would like to touch on the root of hair equity and why it's needed. And this quote from a UVMMC patient and test participant really highlights what this all means. Well, as a Black African woman, my hair represents me. It represents my personality, how I choose to wear it, and how I choose to adorn it with jewels, beads, or colorful threads or extensions. My hair is me. If I lose the essence of my hair care, I lose a part of me. That is why this project is so important, to be able to bring something special to each and every Black and Brown patient, to be included, seen, and cared for appropriately with the right products. And so now, to fully understand the history and cultural significance of curly hair, we must go all the way back to ancient times in Africa. Intricate styles shown in the center picture here would take hours to create, a time that was spent bonding with friends and family. Hairstyles would often indicate aspects of a person's identity, such as marital status, social rank, age, and wealth. And certain styles also reflected spiritual connections, as the head being the most elevated part of a person's body, equated to divine communication. During the period of slavery in the US, enslaved people had their heads forcibly shaved, a dehumanizing act that was an early form of cultural eradication. And as their hair grew back without the correct tools or oils that they used in Africa, they relied on things like cooking grease and sheep combing tools for their own hair. They would use braids as a way to portray hidden road maps for escape, and they would also store seeds for rice and other grains in their hair for food. And hair as a form of resistance was carried into the 1960s civil rights movement. Hair in the natural state, worn specifically in afros instead of being chemically straightened, became a symbol of Black liberation and power. Afros were popular with Black activists, artists, and academics like Angela Davis, pictured in the lower left corner. Movements such as Black is Beautiful were ways to redefine Black beauty standards to embrace all of the unique features of Black hair, bodies, and skin tones. Now, despite the work that has happened from slavery to the 60s and on through today, we still see discrimination against natural hairstyles in places of employment, schools, even Hollywood, and the political arenas like the White House due to associated stigmas and stereotypes. A few examples include former First Lady Michelle Obama, who has said that she felt she could never wear her hair natural or in braids during President Obama's 2 terms, as she knew she would be scrutinized and the backlash would overshadow her husband's work. Oprah made waves for wearing her hair natural for the first time in 2012 on the cover of her magazine O. A news anchor said actress Zendaya looked like she smelled of weed at the 2015 Oscars due to her faux locks hairstyle. A personal story of my own, a young man interviewed for a job at a previous business I worked at many years ago, but he was not selected by the business owners because of his locks, even though they both agreed he seemed like a great candidate otherwise. Andrew Johnson, a wrestler who was humiliated and forced to have his locks chopped off in front of a stadium of people at a high school wrestling match in 2018, or else he would have had to forfeit the game at the insistence of the referee. It's infuriating how many stories there are to reference, so many that the Crown Act, which stands for Create a Respectful and Open World for Natural Hair, was born in 2019 to protect those who experience discrimination tied to race-based hairstyles. It aims to protect natural hair texture and protective styles in the workplace and public schools. The law is currently recognized in 27 states. However, just recently in October of 2023, a high school student named Daryl George was suspended over a month due to his locked hair and transferred to an alternative school to serve his suspension. George and his mother filed a lawsuit as he states his locks are an expression of cultural pride and his suspension violated the state's Crown Act. In August of 2024, the lawsuit was dismissed by Judge Jeffrey Brown, a judge with a record that has been criticized for restricting civil rights in cases that are presented to him. In late 2024, truck driver Drew Harvey was fired by TMC Transportation in Illinois for refusing to cut his locks. Harvey says the company claimed his hair was a safety issue despite him seeing non-Black employees with long hair. The trucking company also refused alternatives such as Harvey trimming or wrapping his hair. So these ongoing cases highlight the persistent discrimination against natural hairstyles and why initiatives like the Hair Equity Project are so important. And so when we go to this next screen, that goes over the hair characteristics. Now that we have a historical and cultural understanding of curly hair, we can dive into the physical characteristics and outline the different products and treatment that curly hair needs in comparison to fine straight hair. Hair comes in all lengths, textures, curl patterns, and strand structures, each requiring different levels of maintenance. Shown on the screen here, you are the hair types varying from number 2 on the left, which is the loosest type of wave, to 4 on the right, which is the more tighter curled, also known as coily. Within each number, there are different classifications of A, B, and C, with A being straighter and C being tighter. If your hair is curly, you likely have 2 or maybe even more than 2 different curl types that you see on the screen coexisting on your scalp. And moisture is an important component to hair health. The scalp and hair follicles produce an oil called sebum. The oil protects the scalp and hair from moisture loss. Sebum has a difficult time traveling down a strand of hair, depending on how many twists and turns it has to contend with. So if your hair is dry, it becomes damaged and susceptible to breakage, which is why it's crucial to keep curly hair moisturized, not only with specific products, but with maintenance. And it is recommended that curly hair types refrain from washing their hair frequently, as many shampoos are made to strip the hair of any oils and products that are present. And so looking at research, these are a couple of quotes from a couple articles that we're able to find. There is little research, there is little written about the benefits of providing basic hair care services for patients who are hospitalized, but evidence does indicate that patients who are clean and well-groomed have better outcomes. And because hair goes far beyond just hygiene, it's a gesture of respect and dignity. Providing proper care not only supports a patient's well-being, but also fosters a meaningful connection between the patient and the provider, reinforcing the compassionate core of health. And this type of care is especially important given the history of racially neglected or racially charged neglect in medical settings. By taking the time to care for textured hair in a respectful manner, healthcare providers acknowledge a patient's identity and they promote trust, boosting self-esteem, which leads to better overall health outcomes for the patient. And so here's another quote. This quote is by UVM employee and highlights the real impact of accessible products and culturally appropriate hair care for patients. So as a healthcare provider in an acute care setting, I see the direct impact on my patients when they do not have the care products that respect their diverse needs. The kinds of products we have accessible for patients to put on their bodies directly impacts how open, comfortable, and safe they feel in receiving our care and their ability to reach their care plan goals. For patients who do not have the option of their loved ones bringing them care products from home, I have assisted many with diverse hair types order olive oil from the nutrition department because that has been safer and kinder to their hair than the bulk products that have been available on UVMMC's shelves. And I've done this presentation quite a bit, and it wasn't until just right now, actually, when I was speaking about the oil that enslaved Africans had to use because they didn't have their own products when they were brought over here, forcibly brought over to the US, that I am drawing the connection to having to go to the kitchen here at Nutrition and get the olive oil because we didn't have, the products to care for these patients to begin with. So it's really, everything is connected here and goes very deep. And so I'll pass this back to Kristen.
Yeah, thank you, Vanessa, for sharing the historical significance and background to this project. I'm going to get to share some of the specifics about our project at UVM Medical Center. And we're going to start with a video that we created to really explain the background of this project rather. And you'll all understand. I feel like this is more challenging than this whole project. I'm going to switch now between the screen and the video. And despite the fact that we've practiced this makes me the most nervous. So give me a second here. Let me stop my sharing. Oh, all right, let's go. All right.
For every patient, being clean equals health in terms of hygiene, preventing infection. And people are coming in bloody from accidents, and no one felt like they could get all the glass out of their hair or the blood off their head. Without the products, we were causing harm.
I had a client that was discharged from the hospital, and because their hair was not careful, they end up having a knot in the back of the hair. So they had to shave that side of the hair because there was nothing we could do to save it.
If you're not meeting the basic needs of a patient, regardless of their race, regardless of their needs, they aren't going to trust you. And that will not just be within the hygiene world. It might not just be your hair care. It overlaps into all areas.
When you tell a patient that you don't have, the proper, products to care for their hair, you're telling them that you do not care fully about them. Now that we have the proper products and we have the training, that's telling them that I see you, I understand you, in order to better and properly care for you when you come in the hospital.
The Hair Equity Project is an example of one of the things I love the most about my job. Not only does it help advance the UVM Health Network diversity, equity, and inclusion strategy, but it also is a really powerful example of what staff-led initiatives can do. It has the power to completely transform how we care for our diverse patients and communities.
This project was long overdue. I'm so grateful to the staff that have been advocating for hair equity for years. Thank you for your dedication.
Hair equity, I think, is a step in that right direction. It's a step towards, I'm looking at you, I acknowledge you, and I want to help you in the best way that makes you feel good, comfortable, safe here, as best as I can, as a healthcare professional, because that's what I'm here for.
All right. I still get chills. I've seen that video a lot of times, and I still feel just so proud to be part of this project. So let me switch back to our slides and get us. Okay, so now we're going to share how we went about making this happen at the University of Vermont Medical Center. So first of all, we have this, you saw some of these people in our video. This was our hair care equity team. And we have patient and non-patient facing employees who contributed to this project to really ensure that as many lenses of health equity were considered throughout the process. So this was our group when we presented at our Health Equity Summit over a year ago. And then we had other supporters, including Dr. Marissa Coleman, who you saw in the video. Gira, who's on this webinar today, and others in different departments. It was such a group effort. It took a full team to make this possible. So I wanted to give you just a little bit of a timeline of how this project was rolled out, because it has taken, as you'll see, it's taken several years for us to really make it possible. So in 2022, Laura DiTilio, who was assistant nurse manager in the inpatient pediatrics department, attended a conference where she learned about a hair care equity project at Nationwide Children's Hospital. Nationwide Children's had recognized that their hair care products that they supplied for patients were not appropriate for all hair types. Laura realized that the same thing was true at UVM Medical Center. And when she returned from the conference, she reached out to at the time it was called the BIPOC Employee Resource Group. Now it's called the REACH Employee Resource Group, Racial Equity and Cultural Humility. And there she found a network of employees who were really excited about bringing this project to our medical center. A committee was created to move it forward. The committee, once we started meeting, developed 4 goals. Our first was to create and develop a hair care curriculum for staff members. Second was to provide equitable hair care products for all patients who are hospitalized. And then also we wanted to develop hair care guidelines for staff members for reference when providing hair care, and then initiate a plan to provide inclusive hair care services for all patients. You can see that after Laura attended the REACH meetings and we brought together this team, that's when I got involved through to provide some backbone support, and that was in 2023. And then we were really lucky to get some funding through a statewide equity learning collaborative that was able to provide the seed funding to get this started. In 2024, we started to launch our trainings, and then in the fall of 2024, and the work that continues today, we've begun our quality improvement initiatives, and now we're starting to roll this out at all of our network hospitals. So Porter Medical Center is starting their trainings next month. So it's really exciting that it's going to be something that we're rolling out throughout the network. One of the things we wanted to be sure that we shared in this presentation was all of the learnings from the project, the struggles as well as the successes. And one of the struggles early on was when Laura attended those employee resource group meetings, some of the employees shared their feelings of hurt, especially some of the employees of color who had been bringing this up as an issue for many years. And it wasn't until a white identifying nurse brings attention to it that it started to gain traction and get addressed. And so this was really, when we started thinking about this really helped those of us involved in the project to explore our own biases. And it brings to light who gets to go to conferences, what roles have that privilege. So we really, as a group, we really spent a lot of time thinking through these systemic issues and working to try to make change at that level as well.
So one of the project's first steps, once the planning committee was formed and a rough guideline was created, was to identify and gather products that were appropriate for the curly hair patterns that I outlined earlier. The BIPOC, the REACH ERG led the research and testing by first focusing on supplier diversity. It was important to work with companies who were BIPOC owned so that we brought in products that were made by people who knew the needs of curly hair from their own experience, their personal experiences. Once we purchased products from 7 BIPOC, mostly Black women-owned businesses, we then recruited 15 test participants who are a combination of community members and employees with hair types that range from 2A to 4C. And they also range from different hairstyles like locked and braids as well. All who participated were adequately compensated for their time and sacred use of their bodies to test these products. We set a new precedent by compensating staff with the help of our legal and accounting departments. A consulting services agreement was utilized to make all testers third-party contractors in order to accommodate their compensation across the board. The health equity grant facilitated by the Community Health Improvement Team, which Christine spoke about earlier, funded the purchase of the test products as well as compensation of the testers. Once we did the product research, that's when we brought in the products. And on the next screen, you'll see the products that we ended up with. We have the shampoos and such on the top shelf there, and then we also have the accessories down below, the tools. So a total of 33 products were tested by each participant over a span of 6 weeks. They were asked to complete a survey after each product used, and every Friday there was a voluntary Zoom meeting for testers to discuss the products, workshop, and network with other testers. The culmination of these research efforts identified mixed chicks as the best suited to meet the varied needs of curly hair types between 2A and 4C. We then presented to UVMMC's supply chain to bring into the hospital. Additional research identified accessories like combs, bonnets, and the satin pillowcases, which, or sorry, not pillowcases, is the bonnets on the right-hand side there, which are very important. If we didn't have any of the other supplies up there, the satin bonnet would be is number one to help maintain the moisture. But along with the product research, we also relied heavily on our hair expert and principal trainer, Pascal Ngonde, as well as experiences from those who have curly hair patterns and healthcare providers who might be less familiar with diverse hair, but still witness the impact of hair inequities. And then on the next screen, we have another quote. This quote helps us shift from the rollout into the next steps of the project. This is from a healthcare worker, just talking about what they were looking forward to at the very early stages of this project. So as a Black multiracial woman who has had more than one stay in the hospital, I know firsthand how it feels to receive overnight products that speak nothing to my needs. Not only are the products wasteful, but I can't use the current offerings without damaging my hair. They are another reminder of how systemic racism infiltrates the most random areas of life by ignoring the needs of entire populations. A person's hair symbolizes aspects of their identity, ancestry, freedom, resistance, creative expression, and so much more. As a patient and as a healthcare worker, I know these products and the hair care training will make it so that those who enter our facilities are well cared for, as well as help them feel seen and dignified.
So we knew that getting the products on our units was an important step in this process, but it would not be enough to just have the products. We have a predominantly white identifying workforce, and many of our staff have had little or no experience with different types of hair. So we knew that training was going to be a really important part of this work. We took a multi-pronged approach to training. So we tried to reach people in many different ways. One thing that we did was create a cornerstone module. I'll share about that in a minute. We had a demonstration table with all of the products at our nursing professional government training days, where hundreds of nurses came through over the course of several days. We did 15-minute hands-on training with Pascal Anguende, who you saw in the video, and we'll talk a little bit about in a bit also. And so we saw, I think, over 60 LNAs during their skills training days. And then we used a super user approach. So we had 40 staff come in for a 1.5-hour training to learn hands-on skills. We have these mannequins that we carry around, and the combs and all the products that Vanessa shared, and people get to really get in there and try detangling and get to wash hair and learn how it feels. And this training, the super users were really charged with being our on-unit experts for the rollout process. And as I mentioned, Pascal was our hair care expert. We were really fortunate to be able to work with Pascal, because not only is she an expert on hair care and owns a braiding salon in Burlington, she's also a former employee of the hospital, so she really understands how the hospital works. And then she was a patient who had her own hair care story. So she's been just an amazing resource to us. And as a result, we were able to work with her. She served as a distributor for some of the products, and we were able to help her grow her business and create a new website and garner some national attention. So it's been this really nice relationship that has had benefits on both sides, and we've certainly benefited. It's been such an amazing experience to work with Pascal. And then here you can see that we have our online learning system is called Cornerstone, and Nationwide Children's Hospital was so generous in offering their resources to us. They offered their training module, and we were able to modify it to meet our goals. And then we created an instructional training video that's embedded into that mandatory training. So this has been assigned to all staff who serve in clinical inpatient direct care roles, such as RNs, LPNs, mental health aides, and others. And as you see here, we've had a 93% completion rate, which just it's really amazing. And some of the people who haven't completed it may be attributed to to some turnover, but we feel really proud of the fact that we've had such a high completion rate for our training. And then in addition, I mentioned some of the hands-on training opportunities. You can see down here our mannequins that we carry with us. Vanessa and I even brought those with us to Minneapolis to a training this fall. So those mannequins have really made the rounds. But we offered a variety of in-person hands-on trainings. As I mentioned, the super user trainings, and any opportunity to really get the staff some hands-on time. As you had heard, our staff had really felt the lack of these products. Some had been purchasing them from home or bringing them in from home, or as Vanessa shared, there were staff who were reaching out to nutrition services. So our staff were really grateful that we were moving this work forward, and they were able to really fully meet the needs of their patients. We're working on continuous training, and so there's different ideas that we have in mind, maybe a cart that goes from unit to unit so people can continue to get that hands-on time. As you can see, from the chart here, we've gone through, this is since we've rolled it out and the products have been on our units, we've gone through quite a few products. It's hard to know the true impact, but we do know at least 600 patients have benefited from this products. And the feedback from staff, like I said, the patients and families have been extremely thankful when we have been able to provide hair care to folks in the ICU. That was one comment we had received. Another person shared, I have only received positive feedback from staff and patients regarding this initiative. Another said, here on my floor, I told one of our patients and she couldn't believe we had these products. She was in a lot of pain, but she managed to shower and use the products, and she even took a bonnet.
Oh, I'm still processing 600 products. That's wonderful. So we had, of course, a few lessons learned, as you heard earlier. Kristen and Vanessa shared a little bit of that. But one of the big things to remember, this is a new type of project for our organization, and we went a different path by design. And part of that is the compensation piece. You heard that there was a lot of testing and a lot of time that was spent to roll out the right products and to make sure this got off the ground in a way that really met the needs of our community. And a lot of these projects, these are, they're seen as diversity, equity, inclusion projects rather than patient care and equity projects. And so they tend to fall on the backs of our employees of color. And we wanted to be able to compensate our staff who are really doing a lot of work beyond the scope of their jobs. And so we worked closely with our legal department. We were able to create some contracts to help compensate the employees that are really holding this project. And it sounds like it would be an easy thing to do to just call up and compensate, but for those of you who work in healthcare, it was a huge bureaucratic lift. It took a lot of hours, and we did have to really explain why this was different than some of the other projects that we roll out. And we did have pushback, and that's where having a leadership support really, I think, drives home how important that is to get projects like this off the ground and to be successful. And then you heard Kristen share earlier that this was grant funded, and that was limited, and the scope of the project was much larger, as it often happens with this kind of work. There's more work than you realize and what you plan for. And so one of the lessons is that we really want to be going forward understanding what that compensation looks like, and what is a good way to do that so that we're addressing that appropriately. And then we also have a policy to compensate our community members who tested the products. We created that in collaboration with our community health team, and that is something that we rolled out, I believe, last year. And so we were able to provide that stipend for testing each product and for their hours spent in providing feedback. The other lesson learned is that continuous buy-in and recognizing that we learned that no one department oversaw hygiene, which was important for this project to roll off. And so this was something that, because it was something different and not through our usual clinical pathway, it was challenging to get it to be sustainable in operations in some departments. So one example on one unit is that these products were in a different area than all the other hygiene products. And so it wasn't part of someone's workflow. And so if you're a staff member coming into stock, you're not going to look into that in that additional area. And the way we uncovered this is through a super user, which also highlights how important it is to have a super user, someone who is an expert on that unit, to be able to catch these things as they go. And so that was one of the things that we realized, that we need to make this as simple as possible and not add to someone's existing work. Otherwise, it'll lose that momentum and that desire. And then in LNA roles, staff turnover is high. And so that was the other thing that we really wanted to make sure we were looking for creative and new ways to continuously offer the training so that we're not losing that support, because our LNA staff is critical in this work. And of course, leadership support. We heard a little bit of that throughout this presentation, but that was crucial, especially with, as I talked about, the compensation. Many of these products are more expensive than some of the others that were reviewed, but we had full support from VPs down all the way up to our supervisors and managers, because everyone understood the need and they knew that we were doing this in the right way by serving our community and doing what our community was asking for. And then we also learn to look for ways to have additional funding so that as we roll this out further, recognizing that we need to be sure that we're thinking about all of these things. And so there's just a lot of learning and many conversations that went into this, but I feel that we all came out like a really strong team, and I'm really impressed with how we went every obstacle that all of us went through. We all looked for ways to push back and find ways to get through that. And knowing that we had the support of everyone behind us, that no one was questioning the importance of this work. It was, how do we do this in a way that we haven't thought of? And I do want to touch a bit on what Kristen shared earlier about the implicit bias. And it was present in how this project was finally off the ground. And it was a white nurse who is an incredible ally, had to be the one to push this through, despite our BIPOC staff requesting that for a while. And why I want to call that out is that this is an example, a real life example that we can share, especially in the role that I'm in, that we can use to teach people what implicit bias looks like and how it shows up and how it impacts the care that we deliver. And really all of this speaks to the need for continuous quality improvement. Sometimes that gets lost in project work, that it's a one and done, and that really can't be the case. And the framework that you see here, that it's called the PDSA cycle. It means Plan, Do, Study, Act. It's a simple QI framework. And that is just one that we felt was easiest to follow. And all it means is that we're constantly planning, improving, and then starting, not starting again, but starting in a better way so that we can continue to do better and improve. And we can move on to the next one. Okay, so as we mentioned, we're rolling this out across our whole network, which is very exciting for us. And we are part of 7 organizations, so we know there's a long road ahead, but very excited that one of our partners, Porter, will be starting training next month. Our hope is by the end of the summer that all of our network hospitals will be live. We also felt it was important to connect with our network strategic plan. All of the work that we do, we really want to be connecting to that plan because it shows that we're connected to the mission, the vision, and the values. And the 2 of the goals on that network plan, which is also part of our diversity, equity, inclusion action plan, is to address barriers to care for our structurally marginalized patients and families, and to educate our people on culturally humble practices, which this project clearly does very well. And then continuing to have proactive training approaches, again, knowing that we just really need to be on top of training, and having it be sustainable means that as we have new nursing staff come in, new LNA staff come in, that they're really entering the workforce with these skills and knowledge. And ideally, if they leave here, they're bringing that to another place. And we are still working on ways to embed that into training. So this is an ongoing process that we're working on, especially as we expand. And the piece that I really want to reiterate is that a lot of people look at this work and they think it's a diversity, equity, and inclusion project. And and our goal is to show that it's not a separate area. This is patient care, and it's rooted in providing care that is culturally humble. And so just take a moment to say that we are grateful that we work in an organization that recognizes the root of this work is caring for a community in the best way possible, and for allowing us to open up opportunities to provide a safe and respectful environment that honors our patients' dignity.
Thanks, Kira. Okay, so we have one more short video, so bear with me as I make the switch, because this, I think, really speaks to why we did this and the importance. And all right, here we go.
And Chris, I might just quickly say that if folks have questions, we'll have a Q&A period at the end of the presentation. So if you have any questions that are percolating, you can start putting those into the Q&A tab now.
Great, thanks, Dan. We should have plenty of time. It's only
How do you make an Airbnb a Verbo? Picture a vacation rental. Now, imagine that every time you stay there, you earn rewards toward your next trip. Congrats! Now you're in a Verbo. Make it a Verbo. One Key Cash is not redeemable for cash and can only be used on Expedia, Hotels.com, and Verbo.
Welcome back. In this morning's Project Community Story, we're highlighting a program in our region that helps maintain care for patients with different hair types during extended hospital stays. We first told you about the Hair Equity Project before its launch at the UVM Medical Center a year ago. Now we're catching up with the people who started it to learn more about the progress they've made.
Some of them have been in the hospital for quite some time, and it just really felt like we were fighting an uphill battle. And when this program came around, it was kind of like a breath of fresh air.
33 different products and 15 test participants, all with varying hair textures. That was just one part of the process, getting the Hair Equity Project underway at the University of Vermont Medical Center.
You don't only have to worry about how you feel or worry about your health, you also have to constantly worry about not losing your hair once you leave the hospital because it was not properly cared for.
Before its launch, health professionals heard from a hair expert, Pascal Ungende, who owns a salon in South Burlington. Her role was to educate doctors about the significance of each patient's experience when it comes to their hair.
It's very important for the medical personnel to care for the hair just as much as they care for the patient health.
Mickey Richer, a pediatric nurse at the hospital, did the training. She said it came just in time when a child almost lost their hair during a procedure, and an emotional moment for the patient and her mother.
She had to step out. Just the emotion that was on her face and just seeing her child be cared for and actually given personal care, that we actually cared about their child as a person, cared about her needs, her beliefs, and were able to do this for her child.
And the conversation at UVM is already expanding. One of the program leaders told me they're exploring other forms of head coverings for underrepresented groups. The development of projects like this takes time. While the program was first planned in 2023, it did take years of funding and careful planning to start it up. One of the leads for the program, Vanessa Rhodes, says putting the concerns and needs of people in the Black community had to come first.
What I really valued through this process is that the hospital and those that were supporting this were putting those who are affected by it at the forefront. So empowered those that have been affected by not having these products themselves to be able to make the decisions and to lead this project of where it needs to go, instead of outsiders coming in and being like, okay, this is what needs to happen. It really was led by BIPOC and those with textured hair, from mostly 3 to 4C curls and different hairstyles as well.
Other UVM affiliate locations across Vermont are also in the process of receiving products and training to expand this program.
All right. So that story was one that touched us all, about a child who was in the hospital they were trying to decide if they needed to shave this little girl's head. And Mickey was like, we have these products, let's give them a try. And after, I think it was several hours, and a lot of products and a lot of work, and they were able to save the little girl's hair. And as you saw, her mother was just so touched by this that it was really an amazing kind of testament to this project. So I think I'm happy to put up our slides with our contact information, but I want to give us time for questions and answer, questions, discussion. So I want to turn it over, Dan, to you to see if there are questions we can answer.
Sure. Well, first off, thank you for a great presentation. And I'm looking at the Q&A right now. So the first question is, first off, thank you very much for sharing. And of the approximately 600 patients served so far, do you have a gender breakdown?
We don't. That is a great question. We haven't looked into the data that closely. I think we've mostly been going by the number of products that have been given out. But I can definitely, we can look into that. I mean, I do think this is something that the products are for any and all genders. And we know that hair care is important to everyone. So that's a great question though.
Okay, great. Another question is, so this is my question as an LNA. Sorry, just moved on me. speaks to Kristen's point on how it is challenging to know the true impact of these products beyond noting how many are used and general feedback. What can we do to move towards measuring the impact? i.e., is there a way we can get these products included into regular patient feedback efforts, as satisfaction surveys, patient intake forms, via questions that prompt patients' awareness of us having these products prior to them coming into our units? Question.
That's a great question. Kira, I wonder if you have any thoughts about some of the work we've been doing to measure the impact of some of these different initiatives.
Yeah, I mean, that's the challenge, right? Is how do we do this right, and in a way that is meeting the community needs. I think we actually have been asking ourselves some of those same questions: is how do we know the true impact of these products, and how do we get that feedback? And we, similarly to the question asked, we thought of surveys. Do we, like intake forms when the patient comes in, do we start there and then after when they're leaving? But there's, if anyone who's stayed in a hospital knows, there's no really good way to truly get that when people are coming in. It's going to be a varied approach. That would be my suggestion based on some of my experience with other similar projects on getting patient feedback.
Okay, thanks. Another question, is this topic exclusive to the Black community? I feel like naturally curly hair in general is looked down upon in the professional setting, but not sure if other groups can be affected as described here.
I can go ahead and answer that one. So it is not exclusive to the Black community. Really, the textured hair comes in all ethnicities and races. So while this project, we did focus on Black and brown folks primarily because we wanted to put them first because of the historical discrimination and stigmas and damage that has been done over the years. So we did focus a little bit more heavily on that, but it really is for everyone. And so anyone with curly hair can receive these products here. And that's the great thing about it, is that it benefits all. It's not just for one segment of the population.
Great, thank you, Vanessa. And we'll just give, another question just came in. I believe you mentioned this initiative is embedded or institutionalized within a larger DEI action plan. Very encouraging. In today's climate, is any of your funding jeopardized by continuing this initiative? Really, really important question.
Kira, I'm looking again to you.
Do you want me to?
Yeah.
At this moment, for projects like these, no. However, this was a grant-funded project, and grants are all up in the air for many reasons. So that is something that's important to point out. But as you know, we have a lot of support from our organization. I think I would go so far as to say we live in a state that is very supportive, as evidenced by having this webinar here. Thank you, Dan. But it is a question that is going to keep coming up. I think it's something we are very aware of, and we're keeping eyes and ears open. But at this point, we really see this as patient care and something that has to be done. Like it feels in our minds like we wouldn't be doing our jobs if we weren't looking out for our community and our patients and doing what we need to do to take care of them. And we're not thinking this is something separate or something that that we're just doing to do. So I don't know, Kristen, if you wanted to add anything, because I know you're tied closely to some of the grants and fundings.
No, I think exactly what you shared. This is just good patient care. This is about meeting the needs of all of our patients, and it's work that I know our healthcare organization is really committed and to making sure this work continues. I'll just share. I'll share our contact information.
Perfect.
We're happy if people want to reach out to us directly. If you are interested in starting a project like this or have questions, we're happy to connect in any way.
And I saw a question in the chat. We will make this this presentation and the recording of the webinar available on Vermont Public Health Association's website. So you all receive a follow-up survey from Zoom tomorrow for people who are interested in continuing education credits. There'll be a link that you can apply for those credits in that survey. There'll also be a very, very brief survey from Vermont Public Health Association embedded in that email as well. And then please do come, give me about a day to get this information up, but you'll be able to find again the recording and the PowerPoint presentation on Vermont Public Health's website on our blog row, which we call our news page. So look for that after today. And please, although we can't hear you clapping or your words, let me, on behalf of all attendees, thank our panelists so much for their, not just their time in sharing the story, but for the tremendous amount of work that your whole team has done to forward this work as it's ongoing. So just wanted to really commend the work and thank you so much for sharing your story with everyone today.
Thank you.
Thank you for having us.
Absolutely. Take care, everyone, and thank you for your time.